So, good day everyone. I'm Bethany Hernandez, second year college from BSN2C. So now I'm going to perform to you the fundal, height measurement, and the Leopold'S maneuvers. So first, we need to determine what is fundal height and what is its importance. So it is used to determine the gestation growth of a fetus. Also, it is used to identify multiple pregnancies and complications of pregnancies. Okay, so first, we should provide for client privacy and we should also provide for warm environment for the patient. So the rationale of this, so that the patient will be comfortable during the whole procedure. For example, if you are in the examination room, we need to close the door or close the curtains. Okay, so after that, we need to check for the patient record or ID. Okay, ma'am. Your name is Marichu Ozame. Okay. And of course, we need to wash hands and observe other appropriate infection control procedure. So the rationale of this to reduce the microorganisms onto our hands. Then we need to introduce ourselves to our client and also explain to the client what we're going to do and why it is necessary. Then explain to the client that you need to get her fundal height, perform Leopold'S maneuver later, and get the fetal heart tone of the patient. So the rationale of this, so that the patient will be aware during the whole procedure. So good day, ma'am. I'm Betty, your student nurse from section 2C. So for today's, I will get your fundal height measurement and also your Leopold'S maneuver. So for the fundal height, we need this to determine if your baby in your tummy is growing properly and for us to get the gestational age. And also for the maneuvers, we need to get the 4 Leopold'S maneuver. First for the position, second for the fetal back, third is for the presentation, and fourth is for the position or attitude of your baby. So then, we need now to, everything after I explain to my client, we're going now to proceed for the procedure. First, we should obtain for the paternal consent of our patient. So the rationale of this is to gain her cooperation. Then, start inspecting and palpating the abdomen of our patient. So the rationale of this, to assess the shape, size, presence of linea nigra, stria gravidarium, and also if there are any palpatable mass. Okay, then we need to encourage our patient to empty her bladder. So the rationale of that is that the fundal height can be 3 cm higher at 17 to 20 weeks gestation if the woman has a full bladder. Okay, so then we need to position our client in the dorsal recumbent with her legs extended. So the rationale of this is to find position has been found to yield less variation in measurement. Then we need to consider placing a wedge under the right buttocks if the gravid uterus is like to compromise maternal or fetal circulation. So the rationale of that, an enlarged uterus can compress the inferior vena cava and the lower aorta, leading to maternal supine hypotension. And also we need to ensure that our hands are clean and warm. So the rationale of that, warm hands will minimize maternal discomfort and potential for inducing contraction of the uterus. Now we're ready to place the 0 mark of the tape measure at the uppermost border of the uterine fundus. Now run the tape measure along the midline of the woman's abdomen at the uppermost border of the symphysis pubis. So ma'am, I will now proceed in measuring your fundal height. Is that okay to you? Okay. Okay, so the distance is measured from the top of the symphysis pubis to the depression in front of the hand, front of the pad. Now we need to document the distance in meters and compared with the calculated gestation. Okay, so the measurement of my patient is 24 cm and it is 2 cm above the umbilicus, meaning the fetus is around 24 weeks. So ma'am, as I get your fundal height measurement, it is 24 cm, which is your 24 weeks pregnant. Okay, so after getting the fundal height, we need to document first the data that we've gathered before proceeding in Leopold'S maneuver. Cut. Okay, so ma'am, for now we're going to proceed in the Leopold'S maneuver. Is that okay to you? Okay. Okay, so now let's do the first Leopold'S maneuver. We need to stand on either the side of the bed and fax the upper part of the mother, grasp the uterine fundus with the both hands, and identify what fetal pole occupies the fundus. Okay, ma'am, so I will palpate your abdomen po, ha? Okay, so when the fetus is in the vertex position, which is head first, buttock should feel irregular shape and firm. But when the fetus is in the bridge position, the head should feel hard, round, and movable. So let's imagine that my patient is in vertex position because I feel the buttocks that is irregular in shape and firm. So ma'am, for the first maneuver, you're in vertex position, which is the baby is in vertex position. I feel that the buttocks is irregular, firm. Okay. After that, we need now to proceed in the second Leopold'S maneuver. We still face the patient and we grasp the size of the abdomen with the palms of both hands and determine on which side is the fetal back or small parts. Once we determine where the fetal back is, we need to determine or count the fetal heart tones using the stethoscope and the fetal Doppler. Okay, so if the fetus is in vertex position, we feel a smooth, hard surface on one side, which is the fetal back. And if we feel lumps, knobs, which are the knees, hands, feet, and elbow, the fetus, elbow of the fetus. But take note, if the fetus is in bridge position, we may not feel back at all. So since my patient is in vertex position, I feel the fetal back is in the right side. So ma'am, since your fetus is in vertex position, I feel the fetal back in the right side. So your fetal heart rate is normal and nothing to worry. Okay, so now we will proceed in the third Leopold'S maneuver. We still stand either on the side of the bed, faces the upper part of the mother using the thumb fingers of one hand. We need to grasp the lower portion of the maternal abdomen just above the symphysis pubis. Now we need to determine if engagement or the fetal presenting part has occurred. If not engagement, a movable body part will be felt above the symphysis pubis. So if the fetus is in vertex position and has descended, we will feel a less distinct mass. But if the fetus is in the bridge position, we feel also a less distinct mass, which could be the feet or knees. So since my patient is in vertex position, I feel less distinct mass. Okay, so ma'am, I feel less distinct mass at your abdomen, and which is the fetal head. That is firm, hard, and movable. Okay, So, for the last Leopold'S maneuver, we should reverse our position to the face lower part of the mother. And we need to place our one hand each on either side of the lower hole of the uterus just above the symphysis pubis. And now we need to determine which side is the cephalic prominence and correctly identify the fetal attitude. Okay, ma'am, this is the last. Okay, so if the head presents, one hand is arrested sooner than the other by the rounded body that's called the cephalic prominence, while the other hand descends deep into the pelvis. If the cephalic prominence is in the same side as the fetal small parts, then the fetal head is in flexed position. Then if the cephalic prominence is in the same side as the fetal back, then the head is an extended position. So because my patient is in vertex position, ma'am, I feel the cephalic prominence on the both sides and it is normal. Your baby is in a good condition. Okay, so after that, after all the procedure, now we need to document all the data that we've covered. Okay, so ma'am, how are you feeling? Okay, so we've done all the procedures for the fundal height measurement and the Leopold'S maneuver. Your baby is in normal position, in good attitude, and everything is normal. So ma'am, you're 20 weeks pregnant. Okay, so that's how I demonstrate to you the fundal height measurement and the Leopold'S maneuver.